most of us have. Overall, American adults report gaining an average of almost 30 pounds in the last year and a half. At the same time, the government shut down gyms and arrested people for going outside. Obesity is one of the main, maybe the main, along with age, contributor to death from COVID. So what is this? Ian Smith has thought a lot about this. He's the owner of the Atilis Gym just outside Philadelphia in New Jersey. He joins us tonight. Ian, thanks so much for coming on. So seeing these numbers, so we've talked a lot about the state of New Jersey's attempt to shut you down and punish you for speaking up about it. But the two numbers since we last spoke that have become crystal clear is that if you're overweight, you're much more likely to get sick from COVID, hospitalized or die, and that people are getting much heavier. So it makes what they're doing to you seem even crazier.
It is. You know, I would love to decide. I would love to know who, in what back room, decided that the way forward for public health for Americans was isolation and mass vaccination. Because 18 months later, as you said, Americans are not any healthier, and in fact, most Americans are less healthy. You know, we're seeing it every day in the gym. People are coming in overweight, having gained 10, 15, 30 pounds from COVID. And where was the outrage, or where was the direction or the money spent on public health that wanted to incentivize people to learn how to take care of themselves, to go outside, to exercise, to do all these really simple, basic things that, if you step away from the madness and the media, all make sense to any rational thinking individual, and that's exercise, good diet, and plenty of sunlight and fresh air.
Exactly. You've been saying this for, I don't know when we first spoke, but it was probably a year and a half ago. You've been saying this the entire time, and they treated you like a criminal. Do you feel vindicated by these numbers?
You know, it's sad, because what we set out to do was provide a solution where the government wasn't coming up with one. You know, we've heard nothing but outrage and fear over the COVID deaths, but what about the 300,000 people that die every year from obesity-related complications? Where is the money spent in the communities? Where are the people going door to door, knocking on people's doors like they are, trying to get them to pander a COVID shot? It's just lunacy. You know, they're not getting the results that they want, and they won't abandon the plan. They're just doubling down on these efforts that are proving more and more every day as we learn more, to be futile at this point. People don't want, people who took the vaccine are going to take it, and those who don't want to take it are not going to.
Exactly. If you treated your kids like the government treats American citizens, your kids would be in rehab. That is totally right. Ian, thank you so much. Ian Smith. It would be abuse. That's exactly right.